is the past chair of the Voluntary Euthanasia Society, and who's going to talk to us about a very controversial subject, which has been recent developments of assisted dying. So I'll just hand you over to Dr. Irwin. Thank you very much.
Thank you. Do I hold this close or? That's fine. Okay. I hope you will applaud like that towards the end. I'm going to begin with two apologies. One is I'm going to be sitting down because I had a very bad car accident about 7 years ago, and if I stand for more than about 10 minutes, you'll see my face becoming more and more distorted because of the pain. So I hope that's all right to you. And secondly, I have the tail end of a cold, so if every now and then I take a sip of this wonderful cider, you'll excuse me for doing that. Now, in this whole subject of what is loosely called assisted dying, it is very important to get the right definitions. I was a speaker at an Oxford Union debate about 4 years ago. The motion was to legalize assisted dying. And one of the speakers there, an expert in this subject, towards the end of his speech, he said, "I hope that everybody at this Oxford Union debate will support the motion, because assisted dying is essentially good palliative care." So you can define assisted dying in various ways, and I'll go into it in detail, but it could be palliative care, it could be voluntary euthanasia, it could be involuntary euthanasia, it could be even the Liverpool care pathway, which you heard about, which is no longer fashionable. It can be doctor-assisted suicide. So it's a very loose topic that I should be talking about tonight. But it's a very topical topic, because you all, I expect, know about the debate that's been taking place in the House of Lords on the draft bill by Lord Faulkner. And his bill is called the Assisted Dying Bill. There's also a debate going on in the Scottish Parliament, and their bill is called the Assisted Suicide Scotland Bill. So even in two parts of the UK, in two different parliaments, they're discussing the same subject, but under different terminology. Now, I will begin by a bit of history. The Voluntary Euthanasia Society, which Tony mentioned I was the chairman of, was founded in 1935, mainly by a group of doctors, among them Lord Monaghan, who was a physician to the royal family, and the Reverend Dick Shepherd of St Martin's in the Field. So the VES, which was the first right to die society in the world in 1935, was mainly funded by a group of doctors and a group of clergy. Whereas today, when we think about trying to have a law in this country on the possibility of, shall we say, doctor-assisted suicide, which is my preferred term, the main opposition comes from religious groups and also the medical establishment. Even more unusual was that the first public meeting of the VES in 1935 took place at the headquarters of the British Medical Association, BMA House in Tavistock Square in London. And that meeting, that first public meeting in this country, was on December the 10th, 1935. Now I'm going to ask a few questions. Why is December the 10th so important? Okay, December the 10th, after 1935, in fact after the Second World War, became International Human Rights Day. And to me, the basic reason, the basic, shall we say, right to end your life with the doctor's help is a basic human right. So the first public meeting took place on what later became International Human Rights Day. The Voluntary Euthanasia Society changed its name in 2005, 10 years ago, to Dignity in Dying. It's still basically the same organization, but I will come later on to explain perhaps why that change of title took place. And then also in this country we have two other groups, small in comparison to Dignity in Dying. In Scotland you have an organization with the wonderful acronym of FATE, which is Friends at the End. And also in this part of the UK, although we have membership throughout the country, we have SOARS, S-O-A-R-S, which is the Society of Old Age Rational Suicide, with which I'm much involved. Now, there are four ways, four levels of what we can call doctor-assisted dying. And I stress the word doctor in all these discussions because it is to me essential that a doctor is always involved whenever somebody's life is hastened at the end. I know some people kind of believe in what I call DIY approaches. They may have bought veterinary Nembutal from overseas, like Mexico or China. They may have a cylinder of helium gas. And these kind of DIY approaches are important if someone cannot perhaps nowadays make the trip to Switzerland or doesn't have a compassionate doctor who will help them. But I always think it's rather unfortunate that people have to resort to that unless, as I say, they can't make the trip or to Switzerland or have a friendly doctor, because then you can get people not being successful in their attempts to end their lives, and also perhaps the wrong people might be ending their lives, people who perhaps are just depressed for some reason. But technically there are four levels of what we call doctor-assisted dying. The first one is perfectly legal in this country. That's when a doctor can withhold treatment or withdraw treatment. Now, I hope you've all heard about living wills, nowadays called advanced decisions. They were for a time called advanced directives, but now the official title since the Mental Capacity Act of 2005, which gave legal status to these documents, they're called advanced decisions. Now, this is a document which you can fill out when you're mentally competent to state the kind of medical care you would like to receive if you're no longer in a situation to talk to the doctor looking after you. It could be, for example, if you develop dementia, or if you have a major car accident and have severe brain damage. How many in this room have a living will or an advanced decision? Okay, I've got this bright light in my eye. I can just see two hands in the front row up and one hand at the back. That's about, what, 5% of the audience. And that's true for the whole country. This to me is very sad, because everybody, even a young adult, should think about the importance of completing a document called an advanced decision. You can get various forms from various sources. The best one is from a group called Compassion in Dying, which is an arm of Dignity in Dying in London. A very detailed document, 8 pages long, but many questions, so it helps you in completing the form. But in this you can state exactly what you would like to happen to you if you could not communicate your wishes. You can also state someone you would like to speak for you, not to change what you have written in the document, but to interpret what perhaps you have written. I, for example, have Angela, my wife, who's sitting somewhere in the back. I can't see her in this darkness, but and I have my older daughter as well as my two healthcare proxies. And nowadays I find the biggest reason that people have to complete an advanced decision is the fear of dementia. With our increasingly elderly population. People therefore living longer are more likely to get dementia. Right now we have about 600,000 people in the country with dementia. In about 10 years' time, maybe about 1 million people, one person in 60 at least, will have dementia. And if you had a living will, an advanced decision, you could say, for example, that if you were to develop an infection like pneumonia, if you had dementia, you would say, no treatment please, no antibiotics. Now if you're a compos mentis, you can say that verbally to the doctor. But if you are in an advanced stage of dementia, that doctor would not know how you wish to be treated. And I'm sure you all remember, at least those who are closer to my age group, that pneumonia was always considered to be the old person's friend in bygone years. So please, if you remember nothing from what I say tonight, please find the possibilities of getting an advanced decision. As I say, Compassion in Dying, you can Google them, you can download the document free of charge, you can go to other groups like the Alzheimer's Society or the Terence Higgins Trust and get also similar documents. So please remember that. And they have, as I say, legal status. The BMA supports them, the Law Society supports them, the Royal College of Nursing all support them. So, and I'm sure that most doctors in this country, if you were to talk to a doctor, would say, yes, it's a good thing to have. So that is what we call withholding or withdrawing treatment. It used to be called passive euthanasia. Perfectly legal. The other means of doctor-assisted dying is what used to be called the double effect, or slow euthanasia, or in hospices, in good palliative care, it's called deep terminal sedation. I mentioned the Liverpool Care Pathway a few minutes ago. And this is when you are in the dying stage of life, but your doctors will give you increasing doses of drugs like diamorphine, which will relieve your symptoms of pain or other distress, and you will be helped to die by those drugs. Technically, the palliative care community will say those drugs are not shortening your life, they're just there to relieve your symptoms. But the compassionate doctor will be generous in giving you more and more doses of diamorphine, so that in effect you will die of that diamorphine overdose. As long as you don't say that's the intention of your treatment, then that is regarded as okay. You're giving huge doses of certain drugs like diamorphine to relieve the symptoms that that unfortunate person is experiencing. So therefore it's semi-legal. The third form of doctor-assisted dying is what we call doctor-assisted suicide. And that's when a doctor will give you medication, or the prescription for medication, that you can then take to end your life. That is legal in 3 American states: Oregon, Washington State, and more recently, last year, Vermont adopted this possibility for terminally ill people only. But it also is possible in 4 European countries: the Netherlands, Belgium, Luxembourg, and Switzerland. And there, in those countries, it is not limited to people who are just terminally ill. By the way, we define terminal illness as someone who's likely to die within 6 months. That's the medical legal definition. But in those 4 European countries I mentioned, as long as you are suffering unbearably and you are mentally competent, you can be helped to die either by means of someone giving you the medication to swallow, doctor-assisted suicide, or by a doctor giving you a lethal injection, which, if you have requested it, is voluntary euthanasia. They don't differentiate in those countries between terminal illness, disabled people like Tony Nicholson, or even the people who are very elderly with various medical problems. And then the fourth possibility of doctor-assisted dying is voluntary euthanasia, where a doctor gives a lethal injection, which is legal in Netherlands, Belgium and Luxembourg. Not in Switzerland, only doctor-assisted suicide is legal there. Now, I'm sure you all read about occasionally people going to Switzerland from this country, either because they're terminally ill, or they are severely disabled, or they are elderly with various medical problems. And the Swiss will accept people from all over the world who are in those three categories. You all know about Dignitas, I expect. But there are two other groups in Switzerland. Dignitas is in Zurich. There's also a group called X, capital E, capital X, International in Bern, and a group called Life Circle in Basel, who are willing to help people from outside the country. Now, one of the important things in this kind of right to die debate is if you can introduce a sense of humor, you know you've won half the battle. How many of you know about the magazine called The Oldie? Excellent. More hands go up. The Oldie, for those who are too young perhaps to read it, is a bit like Punch magazine. It has the best cartoons of any British magazine. It's a monthly. 2 years ago, they had a cartoon that showed a man sitting at a table, a bit like this. On one side of him was his wife, other side of him were two middle-aged children. On the wall behind him it said Dignitas. And on the table was a little glass, about that big, about half full. So you knew by just looking at the cartoon that if he was to drink that, he was going to die. And the caption of the cartoon was him saying to his wife, "Does it contain nuts?" Now, when you could laugh about that situation, I said, you've won half the battle. Because we have a two-tier situation now in this country. If you have the money and you can plan ahead, so it takes 4 or 5 months from the day you first contact one of these Swiss organizations to the day that you'll go to Switzerland, then you can go to Switzerland. And about 250 people from this country have made that journey. Initially, the legal authorities here were somewhat concerned. 6 relatives or friends, when they returned to this country, having taken someone to Switzerland, were arrested and questioned by the police. But nobody has ever been charged for doing that. I have been 4 times to Switzerland with people. One was a good friend of mine who was 85 years old, who was suffering more and more from osteoarthritis. Life is more and more restricted by that condition. Another was a man with Huntington's disease in a wheelchair, getting close to the point where you'd have to be tube fed. And 2 were terminally ill, one with cancer of the pancreas and one with a condition a bit like motor neuron disease. Later on, if we have time, I can tell you more about these 4, but I'll tell you a little bit about each of them very quickly, because it was a privilege to go with these people on different occasions. And the first was May Murphy, 10 years ago. She had this motor neuron disease condition, and we flew from Glasgow, because, you know, in Scotland it was never a crime to assist anyone in a suicide. In this country, up until 1961, if you helped somebody before 1961, that was, you know, you could be punished severely, perhaps even executed, and get your objection that way. After 61, officially, if you assist someone in a suicide in England and Wales, you can be sent potentially to prison for up to 14 years. But in Scotland, it never was a crime to either commit suicide or to assist someone in a suicide. So May Murphy lived in Glasgow, and I accompanied her to Switzerland. We wanted to highlight the fact that she went publicly, the media were fully informed. We wanted to highlight the fact that Scotland and England were different on this issue. But I can remember on the plane, as we went on a KLM flight, she turned to me and said, because we had a little sandwich on the plane, "This is my last supper. I only have one disciple with me." And as we landed in Zurich, we had to change planes in Amsterdam, and when they always say on a plane, you know, "Thank you for flying KLM, have a good onward journey," in a very, very loud voice, knowing that she would die next day with the help of dignitaries, she said, "If only you knew where I was going." She was completely relaxed. The next person I accompanied to Switzerland was Raymond Kelvin, who was dying of cancer of the pancreas. He wanted to make an issue of the fact that he was going to Switzerland. He was a gay man, he was in a civil partnership with Alan Rees, and they thought that their story, a gay couple involved in going to Switzerland, would make the headlines. This was about 8 years ago. The Guardian interviewed them before they left London. Also with us, his partner came as well, was Raymond's 25-year-old niece, Simone. And the best memory I have of Raymond was that just before you take the fatal Nembutal to end your life, you're given something to settle the stomach, because a Nembutal can make you vomit unless there's something there beforehand in the stomach. And he had the music of Diana Ross playing in the background, because he had been involved in Motown music. And just before he was to take the lethal Nembutal, he said to his niece, "Can we just dance?" He was weak, he was quite jaundiced from his cancer of the pancreas, but I can still see him kind of swaying slightly like this in the arms of Simone. And 5 minutes later, he died. But when Alan returned to London and called the Guardian and said, "Raymond has died, now the story can be, written and printed," they changed their minds. "Oh no, it's no longer a matter of, no more news about people going to Switzerland, it's people going all the time." So Alan was furious. He lived in Hackney, he went to the Hackney Gazette, he challenged the local police in Hackney to arrest him. And after a year of this, he was arrested. And because I had helped financially, because they were pretty impoverished, these two, I'd helped them to go to Switzerland, I was also arrested. And Alan and I were on bail for 1 year, never charged. The third person I accompanied was Dave Richards, who had been, he'd worked on the North Sea oil rigs. He was a geologist. And I can remember he was in a wheelchair, and because of his Huntington's disease, we had to spend 48 hours together because his wife preferred not to come and see him die. She said goodbye to him at their home on the Isle of Wight. What do you talk about with someone who's going to die at a certain time, say a day or two later? Because of his illness, we didn't go out, we just sat in the hotel room, listening mainly to CNN. And I remember we discussed everything from Formula One motor racing to the nature of the universe. But when we had to go get into a taxi to go to the dignitary's house, I had to wait in the lobby of the hotel, and I said to Dave, "It's lovely marble on this floor." He said, "No, Michael, it's granite, not marble." He gave me a 5-minute dissertation about the difference. Yet an hour later, he was dead. And the fourth little quick story I'll tell you involved Nan Maitland, this 85-year-old friend of mine. She went to a group in Bern, one I mentioned called Ex-International. And again, you have to wait while, as I say, after you've taken something to settle the stomach and before you drink the Nembutal, wait half an hour. And she'd met my oldest granddaughter, who was then 22 years old or so, who'd been studying in China. And so Nan said to me, "How's Sarah Kate?" I told her. 5 minutes later, she said, "This nail is rather sharp. Do you have a nail file?" Well, I didn't, but there was a lady present who did have a nail file, so that nail was filed down. 10 minutes later, Nan was sitting on the bed, about to drink the Nembutal. She drank it quickly. I was sitting next to her with some Lindt chocolate in my hand, because chocolate can kind of mask the taste of the Nembutal, which is rather bitter. I said, "Nan, you want this chocolate?" "No, thank you, it's not too bad." Those were her last words. Now, it was a privilege to witness these 4 determined individuals who made the journey to Switzerland. And I know damn well that if the law hasn't been changed when I want to die, if I have a choice about how I want to die, then I shall certainly go to Switzerland myself. Now, doctors throughout the world help people to die. It always has been the case. Most parts of the world it's totally illegal. We didn't know in this country how much illegal assisted dying took place until 2004, when a professor at Barts Hospital in London, Professor Clive Seal, did a survey of about 3,000 doctors, asking how had they helped people perhaps to die in the past year. And from that survey he deduced that there had been at least 1,000 cases of voluntary euthanasia, that is a doctor giving an injection to end someone's life at that person's request, and also at least 2,000 cases of non-voluntary euthanasia, that is where the patient is close to death, not able to communicate, but a doctor gives a lethal injection. 1,000 voluntary, 2,000 non-voluntary cases of euthanasia every year in the UK. Totally illegal. He also deduced from that survey that 1 death in 6 back in 2004 was brought about by the generous use of drugs like diamorphine. That deep sedation I mentioned, that Liverpool care pathway, that double effect. Now that survey was considered to be so reliable that it was printed in the magazine Palliative Medicine in January 2006. And that journal is the journal of the palliative care community. They accepted Clive Seal's results. So it happens in this country. It should be out in the open, it should be legalized. And that survey was repeated by Clive Seal 3 years later. Again, similar results, again published in Palliative Medicine. What is the best example we have of non-voluntary euthanasia in this country? That is someone's life being ended without their knowledge. Any of you think about the royal family at this moment? King George V in 1936. He was dying slowly from a series of minor strokes. Even on his last day, he said to his chief aide, "How is the empire?" and quickly reassured the empire was fine. But Lord Dawson, the royal physician, spoke to the Queen and the 2 royal princes and said, "The king cannot last much longer. I will end his life," and they agreed. The king wasn't consulted. He was given an injection of cocaine and morphine into the jugular vein in the neck. He died in a matter of minutes. This occurred about 10 o'clock at night. So they had time in which to inform the editor of the Times before 10:30. So that was the headline next morning. That was the establishment paper back in 1936. And that year, later that year, there was the first debate in the House of Lords about having a law in this country to authorize, legalize voluntary euthanasia. And Lord Dawson got up and said, he didn't admit to what he had done then, that came out some years later, but Lord Dawson in that debate said, there is no need to change the law, all good doctors do it. Now, in the parts of the world where this matter of doctor-assisted suicide voluntary euthanasia is legal, we had the Netherlands. They've had guidelines between the medical and the legal professions since 1981. It's been legalized since 2001. And about 3% of deaths in the Netherlands take place now due to voluntary euthanasia. A few will be assisted suicide, but the majority choose to have voluntary euthanasia. In Belgium, it's been legal since 2002. In Belgium, it's a very interesting situation, because in Belgium, you know, you have two main parts of the country. You have the Flemish-speaking part, and then the French-speaking part. In the Flemish part, which is close to the Netherlands, but they have very good palliative care system, as good as we have here. We have one of the best systems in the world. In that Flemish part of Belgium, they have integrated the possibility of voluntary euthanasia into palliative care. So if you are receiving palliative care, but you've got to the point when you feel you've had enough, you don't want to go on any longer, you can then say to your doctor, please, let's end it right now. And that doctor is then obliged, or if he has objections, he has to bring in a colleague to then perform voluntary euthanasia. In Switzerland, the matter of only doctor-assisted suicide has been possible since the 1940s. Now, in typical Swiss way, no one knew about this until 1996, 50 years later. And I was at a world conference of what's called the World Federation of Right to Die Societies, which met in Melbourne in that year. I was at that conference, and I remember the Swiss delegate admitting to what they've been doing in Switzerland for 50 years, helping Swiss nationals. Because dignitas did not come into existence until about 20 years ago. And in the three American states, Oregon, Washington State, and Vermont, you've had the possibility of doctor-assisted suicide for those who are terminally ill. It was initially in Oregon in 1994. They had a statewide referendum which showed a 51% in favor of that possibility. That was then blocked by various religious and medical bodies in that state, and the state was ordered to have a referendum 3 years later. I don't know whether any of you know about people in Oregon, but they are very independent, very white, very liberal community. They didn't like being asked again for the same question, so this time the vote was not 51-49, it was 60-40 in favor of changing the law and bringing about the possibility of doctor-assisted suicide if you're terminally ill. But even in Oregon today, in spite of having this law now for 20 years or so, only about one person in perhaps 500 chooses to die this way. And in general, you'll find people who choose, like in Oregon, or choose to go to Switzerland, or even in Switzerland or even in the Netherlands, who choose to have voluntary euthanasia. By and large, they are people who are fiercely independent, who have been, I hate to use the word, shall we say, in a profession. They have been in charge of their own activities. They're usually very liberal in their thoughts. They can be religious. But they're those people who have been in control in their lives and want to be in control at the end. Now, we know in this country there is considerable support for changing the law. Figures roughly 75% will say, yes, the law should be changed to allow for doctor-assisted suicide or even voluntary euthanasia. Now, the Voluntary Euthanasia Society, which I was chairman of, used to say that this policy was to help any competent adult who was suffering unbearably to have the doctor's involvement in ending their life, either by giving them a prescription, a medication, or by an injection. not differentiating into terminal illness, disability, or elderly. Anyone who's just suffering unbearably who was competent. When VES became DID, Dignity in Dying, in 2005, the new board felt that they should try and copy the example of Oregon and only focus on the terminally ill. So that is why you have now the Lord Faulkner's bill, the draft bill in the House of Lords, which I'll come to in a minute, only on that particular category of people who are terminally ill. But we know, as I say, that at least a 75% support for changing the law. The BMA, at its annual conference in 2005, adopted a neutral position and said, it's up to Parliament. We won't get involved unless Parliament says we should. Unfortunately, that motion was adopted on the very last day of the BMA conference, when many people had gone off to play golf, and that motion was then overturned the following year, mainly by the influence of the, what was it called nowadays? It's changed its name, but then it was the, well, it was the Christian Medical Fellowship, that was the title. And so they changed, got the BMA to change its neutral position a year later in 2006. But the Royal College of Nursing, since 2009, has adopted a neutral position. So let's sit now. Now, I'm not sure I should mention anything religious to a group of secularists, but I will tell you something about the Bible. I had a good friend, unfortunately he's dead now, but he was a bishop in the Church of Scotland called Alistair Haggart. And he told me that there are 8 suicides mentioned in the Old Testament. Samson, Saul, for example. And of course Judas mentioned in the New Testament. But none of these suicides are in any way condemned in the Bible. There's no moral judgment about suicide in the Bible. It wasn't until the 4th century AD when Augustine, St. Augustus, said because so many Christians were committing suicide, being told because their lives were pretty miserable on this planet, that the hereafter was a wonderful place to be, so the church was losing a lot of supporters. So Augustine said, stop, stay on the planet, support the church. Suicide is a sin. So since then, it has become at least the official Christian philosophy. Although, as I say, nothing in the Bible condemns the possibility of suicide. In the Hippocratic Oath, which was written by a group of doctors in the 4th century BC, again, nothing against a doctor being involved. In fact, if you follow the Hippocratic Oath, there'll be no abortions, there'll be no female physicians. Now, the various attempts in recent times to change the law, because there have been at least 10 attempts since 1995, since, I've got my dates wrong now, since 1936 rather, been about 10 attempts in either the House of Commons or the House of Lords to change the law to have a right to die law in this country. There was one serious attempt in 2006 by Lord Joffe, Joel Joffe, a very nice man, a human rights lawyer who defended Nelson Mandela, because he was a South African, Joel Joffe. And he tried then to have a law passed, a doctor-assisted suicide law for the terminally ill. It lost in the second reading, was defeated by 148 to 100 in the House of Lords. Now, there are about, I don't know, 850 members of the House of Lords. When they came to this debate, this vote, in 2006, only about a quarter turned out to vote. And none of those beloved 26 Anglican bishops in any way supported Joel Joffe. Although you know very well that most members of the House of Lords will have private physicians, and we know that some private physicians will quietly help their patients at home to die. Lord Faulkner has introduced a bill, the Assisted Dying Bill. Unfortunately, because now we have no Parliament, his bill as such will not become law. But there have been 2 good debates in the House of Lords on his bill, and in the new Parliament there will be an attempt initially in the House of Commons under a private member's bill to introduce something similar to the modified Faulkner bill that has been produced in the House of Lords. In Scotland, as I mentioned earlier, there is this Assisted Suicide Scotland bill being discussed right now, because the Scottish Parliament is continuing for another 18 months or so. And that is not only for the terminally ill, but also, as they say, for those who have a life-shortening condition with no prospect of any improvement. So someone like Tony Nicholson would be helped under the Scottish bill. He would not be helped under the Faulkner bill. Now, my main interest now is in, shall we say, expanding the restrictions of the Faulkner bill, going back to the old VES objective. And because I'm getting elderly myself, I shall be 84 in 2 months' time, I worry about the possibility of what might happen to myself. And so back in December 2009, on Human Rights Day, December the 10th, several of us who had been active in the VES before it became Dignity in Dying established this group called SAWS, Society of Old Age Rational Suicide, to make certain that perhaps this category of people should also be considered when any bill is discussed in future in our Parliament. We have, as our logo, some of you may have picked up this form on the table over there. The logo is the derelict West Pier at Brighton, which of course was once a place of great excitement and pleasure. Like many elderly people, like myself, one becomes more debilitated with age. So our logo is that derelict West Pier. We use the word rational suicide, and I think it's very, very important to develop that concept of rational suicide. We have an exercise going on at present among our members of SAWS, and by the way, SAWS is a wonderful acronym, because you can think of bed sores that elderly people get. Or if you want to think of it when you die, something perhaps soars off into the ether. So we like to think about the idea of when you become elderly, you get to what you can call a completed life. You have done all the things you want to do, whether it's career, write a bestseller, visit far remote parts of the world. You become more and more debilitated because of age. And yet you know, because of modern science, modern medicine, you might be going on to live into your late 80s or 90s quite easily. Why shouldn't you have the option of a quicker exit if that's what you would like to have? Which is possible in both the Netherlands and in Belgium and in Switzerland. We've done various surveys, and in this particular leaflet you'll see the results of those surveys mentioned. The most recent one was in March of 2013, when 70% of people, over 1,000 were questioned, 70% of people agreed with the concept of old age rational suicide. At the same time, we asked the question, should terminally ill people have the possibility of a doctor's help to die? And 78% said yes to that. So I think that I've been talking maybe more longer than I should. I have got copies here of a book called Approaching Old Old. Now, the word or the expression old old comes from a recent American medical dictionary. In America, no one's old. You're a senior citizen, or something like that. But in this medical dictionary 3 years ago, they defined for the first time old old as someone who was 85 years plus. And this is a book that I wrote last June, in which I say that now at 83, as I was then, I suppose that I'm now living on borrowed time. I'm getting past my sell-by date. I'm approaching old old. So this is a booklet in which I developed the concept of old age rational suicide. Now, I've only brought 20 copies with me. They're free of charge. I'd like those who have either grey hair or no hair to have this booklet. And if there are any more left over, then the younger ones can have a copy. But at the end, you're welcome to take a copy with you. I think at that point, Tony, I will stop, and hopefully there'll be some questions. I can elaborate on other points.
Yes. Well, I'm sure we'd like to show our appreciation for a very informative... And being
Thank you very much.
a democratic organisation, would people like to go straight to questions, or would you like a little break or a little drunk break? How many people would like to go straight in? Can we show of hands? 1, 2, 3, 4, 5, 6. I think I'll see 6 or 7. How many people would like to have a little break? Oh, nobody.
Oh.
Right, everybody else is voting.
On the fence.
Right, so we'll go straight in. Do you want to have your questions, or shall I? How do you want to do it?
You'll just go ahead and raise a hand. And,
Right, okay.
Although I've got this light in my eyes, so I can't see everywhere around the room.
Now, who would like to ask the first question? Yes, I'm in the...
Is there a reason why only the Walloon side of Belgium, Flemish-speaking side of Belgium, has taken this liberal approach and the French side not?
A very good question. Mainly religious. The French portion is more Catholic than the Flemish portion. That's a simple answer. But throughout Belgium, they have a very good palliative care system, as good as we have in this country. But when it comes to change taking place, it's often a few physicians who will be the brave ones who will develop the possibilities, shall we say. And it was certain doctors in the Flemish part who then promoted the idea of the law change in Belgium. So they were there in place when the law did change, and therefore ensured the integration of voluntary euthanasia with good palliative care. But you see, and again, that could expand this into a question now, because people often say, why don't we have a change in the law in this country? And there are basically 3 main groups that are resistant to change. One is religion. In this country, it's mainly the Catholic Church, although Islam and Judaism are also opposed to change in the law. There's also the medical establishment. Now, a slight majority of doctors, when asked individually or in surveys, have said the law should be changed. I mentioned how it was possible for 1 year for the BMA to have a neutral position. And when I talk to other medical friends and colleagues of mine in the past, the majority of them will be in favour of changing the law. But doctors are, in general, small c conservative. They don't want the bureaucracy to be involved in judging what they do. So the official medical establishment, whether it be the BMA or the Royal College of Physicians or Royal College of Surgeons, have said up to now the law should not be changed. But as I say, I know that individual doctors, by a slight majority, would support it, and we know that, as I mentioned by that survey by Clive Seal, doctors do help their patients in that way. Another group are the disabled group. Although there are many disabled people who favour a change in the law, because somebody who is disabled from, say, a car accident in a wheelchair, they can still get cancer or other terminal illnesses. So in that way, they then become like anybody who's not disabled. But the main objection of at least the leaders of disability organizations is that they feel that right now, people seen in a wheelchair are regarded by some people as being, shall we say, second-class citizens. I hate that expression, but you know, there's not that complete tolerance that we should have about disabled people. So if the law was in place to allow the possibility of doctor-assisted suicide, they feel there might be more pressure on disabled people to take that option. But one of the good things that came out of the discussion on Faulkner's bill, it wasn't in the original draft bill that he presented to the House of Lords a year ago, but in the debate that took place last December. And this was an amendment introduced by the opposition to changing the law, was that there should be also somebody from the family division of the High Court to question the individual who wants to die, to make certain there's no pressure on that person from family or friends. This would be a very private interview by that legal authority. And one of the stipulations we have in the possibility eventually of helping elderly people, old age rational suicide, is that in addition to having 2 doctors involved in assessing that person's wish to die, judging their competence and the severity of their medical problems, there also would be a legal person of experience in family matters to question that person about their sincere wishes and make certain there's no pressure on them. So one would hope that that particular safeguard that will be in future bills in this country would reassure the disability organizations.
Thank you. Anybody else? Yes, in front of you.
You mentioned that the Faulkner bill you felt didn't quite cover all the cases that a more perfect law might cover. You also mentioned how there are these differences between the states and the 4 countries. Which sort of formula would you consider the most effective?
Keep it simple is the answer.
Yeah.
And I would say that and in fact I will put down this microphone and get out of my wallet. This was a card I had when I was chairman of VES. I'm showing it to you for 2 reasons. Because on the back it says, the VES aims to make it legal for a competent adult who is suffering unbearably from an incurable illness to receive medical help to die at their own considered and persistent request. That covers everybody, terminally ill, disabled, like a locked-in syndrome, Tony Nicholson, or the elderly person whose life is more and more restricted by arthritis or other conditions like that. Suffering unbearably and mentally competent are the 2 main criteria. Now the other reason I carry this around with me is that when VES went through this rebranding process to become Dignity in Dying, where they would then limit themselves only to the terminally ill, and they spent months thinking about what the new organisation should be called. They came out with Dignity in Dying. And yet on the card I had when I was chairman of VES, that's the main headlines, and then it says, "For Dignity in Dying." Because that was the campaign slogan that VES had. And yet those who were rebranding the organisation hadn't consulted the old documentation, so time and money was spent on it. So you reinvent the wheel. But in Belgium, in Switzerland, in the Netherlands, the only criteria is competence, that you know what you're asking for, and you're suffering unbearably and irreversibly. That's all.
But you mentioned, for example, the Alzheimer's situation.
Okay, now Alzheimer's is something special, and it's a very important one. In the early stages of Alzheimer's, most people have a year or so in which they're still sufficiently mentally competent, knowing that they are developing this disease, to ask for help to die. Several people from this country have gone to Switzerland in that early stage of Alzheimer's. I've been involved with 2 of them who have gone there. And that possibility exists in the Netherlands or in Belgium as well. But in the early stages of Alzheimer's, if you're judged still to be competent to know what you're asking for, you can then receive either euthanasia, voluntary euthanasia, or a lethal medication. That is why I'm delighted that there's now this emphasis in the NHS for early diagnosis of dementia. Because that means that if that does happen, and people are told, yes, you are in this early stage, then if they have the possibility, those people can go to Switzerland now, or when the law is changed in this country, don't ask me when that might happen, then those people could also be helped in this country.
You would presumably, we want to press for a change in the law here.
Yes.
And we need...
Well, I mean, I certainly support Dignity in Dying and what it's doing. I mean, but let's say that the present emphasis on getting the law to help the terminally ill is the first step. And then, maybe a few years later, you can have further discussion in Parliament to then bring about including others, like those who are severely disabled or elderly. Now, the opposition will say that's a slippery slope. But what's the best example of a slippery slope in this country, or in many countries?
Votes for women.
Sorry?
Votes for women.
Votes, of course, absolutely right. You know, several centuries ago, only rich landowners, male, could vote. Then only men of a certain age could vote. And then 100 years ago, women got the vote, but only over the age of 30, I think it was. And then gradually it came down to now age of 18. Each time Parliament took a sensible democratic decision to change the possibility of who can vote. Likewise, I would say that if Parliament, hopefully in the next year or 2, might adopt a Faulkner-type bill to help the terminally ill, that then certainly there's nothing wrong in, say, 2 or 3 years later, coming back to Parliament again to say, well, look, people who are severely disabled, like Tony Nicholson, or the very elderly, they are suffering much more severely and much longer than someone who, by definition, is terminally ill, who will die in a few months. So therefore, the law should be changed to include them. And we are part of Western Europe, I hope, in spite of UKIP. But we could therefore copy what other Western European countries have done.
But it will require a statute. It can't change
Yes.
through case law.
Yes. Yes.
I think I saw a couple of other hands. Ross?
Yes. Some people who commit suicide, they're not physically ill, they're not mentally ill, but they have their reasons. And of course, sometimes they don't make a very good job of it. They don't die, and so they may end up incapacitated, or they may do it in a way which is dangerous to other people. So why I appreciate the blindly just been putting forward about sort of Fabian inevitability of gradualness, that in the long run, do you think assistance to die should be available to people of the sort I just described, not physically ill, not mentally ill, but they don't want to be around any longer?
The simple answer is no. Doctors have to be involved in this process. Doctors have to evaluate the mental competence of someone, that they are competent to take a decision, and doctors have to assess the severity of the medical problems that someone has. Now, generally, we're talking about physical mental problems. This is a big debate going on now in Switzerland and in the Netherlands, whether people with certain psychiatric problems should also be helped to die. Now, terminology in psychiatry has changed since I was a young medical student. In my young days, you had either a neurosis or a psychosis. The neurotic were those who were anxious or depressed. The psychotic were those who had schizophrenia, is a poor definition. In Switzerland, they are willing to occasionally help someone who has a severe form of schizophrenia. But they will never, in Switzerland, help somebody who is, quote, depressed. In the Netherlands, there was a famous case 7 or 8 years ago of a doctor, he was a psychiatrist, who helped a lady to die who had been under treatments for severe depression for many years, following the death of her husband in a car accident and the death of one of her children. That psychiatrist got 6 other psychiatrists in the Netherlands to support that lady's wish that she should have voluntary euthanasia, which she received because her treatment had not been successful. There had been all kinds of attempts to cure or restrict, limit her depression. That doctor had to defend himself in court. In the end, nothing further happened to him. So I think that maybe there are some psychiatric conditions, which I used to call, as I say, the psychotic conditions, like schizophrenia, which are so difficult to treat, that they might eventually be covered by some right-to-die law. But one should be careful. I think initially it should always be on those who have severe physical mental conditions. And I'm totally against anybody who tries, as I said, these DIY approaches at home, unless they are in a state of advanced physical decrepitude and they cannot possibly get to Switzerland. Although that definition of getting to Switzerland is one to be careful about. For example, just last week, I helped to arrange this, a man who a year ago, he was 71, in a car accident, he was paralyzed from the neck down. He went to Switzerland last week, not to Dignitas, he went to the group in Basel. He went by car ambulance and by air ambulance to Switzerland. At his age, he knew that the possibility of any recovery was remote. Someone who was 21 rather than 71, there might be in 10, 20 years' time some way to correct some, awful disease of the spinal cord. But at present, that was the decision he took. The lady back there.
What if you took into account someone's advance directive?
I'm sorry?
If you had an advance directive,
Yes.
and you sort of identified in that if you did lose capacity at any point, and it got to a point where you were like severely disabled by conditions such as like dementia or Alzheimer's or in that sort of area, would it ever come into?
I'm sorry, I didn't quite.
You want to kind of come up and talk to the microphone? I got advanced
You said advanced directive, but advanced decision is now called.
Yeah, if you have an advanced decision
Yes.
regarding losing capacity if you're older and you didn't get your diagnosis of dementia in time and you'd already lost too much capacity to make that sort of decision, whether you want to die, would you be able to make the dying decision before?
Oh yes, that's the point of advanced direction and advanced decision, is that you state what you would like your medical care to be when you can no longer communicate with a doctor, when you have dementia.
So would you'd be able to put in that I'd like to be using
No, you can't put in that, because that's not legal in this country.
if it was?
But you could say, I don't want to have treatment if I get some life-threatening condition like pneumonia.
And what if you'd written?
I'm sorry?
If you'd gone to one of your family members and said if I lost capacity, would you
I'm sorry, I can't hear. There's a constant buzz over my ear here. Come up and talk to this.
If you'd come up to one of your family members and asked them if I lost capacity and got dementia,
Yes.
if they took them then to Dignitas or something like that,
You can't go to
would that-
Dignitas, no.
because it would be a case of like loss of
Yeah.
capacity.
No, you see, if you go to Switzerland, and it's very complex going to Switzerland, you've got to produce detailed medical records of your illness, going back over several years, plus an up-to-date record. You've got to prove who you are, and not just simply a gas bill with your home address on it. You've got to go to a public notary who has to make a statement that you live at so-and-so address. If you've been divorced, you've got to produce the divorce documents and even your ex-spouse's birth certificate. It's a very complicated process. The Swiss are very bureaucratic, as we know. But the main reason for this extensive documentation and so on is you've got to be certain the person going to Switzerland is a person who wants to die. Because there was an awful example of someone from Germany who assumed the identity of a neighbor who had a severe physical illness, but that woman who assumed identity was only depressed. She went to Switzerland and died there, based upon the false documents she had produced from her neighbor. So that's why it takes several months before you get the approval to go to Switzerland. But when you get to Switzerland, you are examined twice by the doctor who's looked at your records sent in advance. And that doctor has to make certain that you are mentally competent at that moment to take that decision to die. So if you have a dementia, not in the early stages where that competence is still okay, but your dementia has gone beyond that, then the Swiss will not allow you to die in their country. That's why the advanced decision is so important in this country, because you can then stipulate, as I said, if you get some complication in your life, which is life-threatening, you can say, please don't treat that. Excuse me. Plus also, when you fill out that advanced decision, it is important to get your GP to put his name to it, because then it shows that he has questioned you about your intentions at that time when you were competent in completing that document. Does that answer your question? I see you not anyway.
How much does the one-way ticket to Dignitas cost?
How much was I?
How much does the one-way ticket fee
Ah.
cost to go to Dignitas?
Okay, going to either Dignitas or the other two groups, on average, you've got to think about, say, £9,000. Because, first of all, you have a cremation in Switzerland. Unless you want to be buried in Switzerland. But most people nowadays are cremated in Switzerland and the ashes come back here. Now, cremation costs, even in this country, costs about £2,500 on average. So about a third of that £9,000 is the cost of a cremation in Switzerland. Then again, you've got to think about staying in Switzerland for at least 2 nights, because you've got to see a doctor now on 2 different days who assesses your competence and your medical condition. And hotels in Switzerland are not cheap. Plus, you should go with somebody, preferably 2 people. Because if you just go, say, with a spouse, then that spouse needs to have someone, a friend, to help to bring them back to this country because of the trauma of having experienced what has happened. Then again, Swiss doctors, they have to look at your medical reports when they're sent to Switzerland. They write a report which is looked at by the Swiss authorities afterwards. So they have to be paid for their time in assessing those documents, as well as seeing you for at least, say, half an hour each time when you're there. So very quickly you add up to about a grand total of about £9,000.
All right, and I have the good fortune of having friends in Basel, so I've cut down the bill a little.
You're very lucky. Now in Basel there's this group called Life Circle, run by a very dynamic Swiss lady doctor called Erika Priesik. Now how many of you remember seeing the Terry Pratchett video, which was shown on the BBC about 3 or 4 years ago, where he accompanied Peter Smedley, who had motor neurone disease, to Dignitas? Does some of you remember seeing that video? Okay. The lady who questioned Peter Smedley 3 or 4 years ago, shown in that video, was this Dr. Priesik, who then went back to her hometown of Basel 18 months ago and set up this organization there, which also helps people. You may have read about, for example, this was in the Sunday Times, I think it was in mid-January this year, where the report was made of 2 elderly Scottish cousins, one male, one female. They were both in their 80s. They'd never been married, but they lived together. They just felt it was an easy thing to do for about 40 years. One was going blind, one was going deaf. They went together in last, I think it was maybe October or November last year, they went over to Basel and they died there. But the report didn't appear in the British media until, they say, the Sunday Times, I think in mid-January. But again, an example of old age rational suicide. These 2 had been supporting each other for 40 years or so, but because of their combined disability, deafness and blindness, knew that they would, at one point, if they stayed alive in this country, would be put into separate care homes, very likely. They didn't want to do that. They knew they couldn't live much longer. That, to me, was a very rational decision on their part to end their lives in that way.
Any questions? Well, there's someone in the back corner. You mentioned just now Terry Pratchett, Michael, and of course if he had gone through the process of the Swiss process, that would have got the media spotlight on it, but he died very recently, and in all the obituaries I've read, they just say natural causes, nobody says anything else. Does that make you wonder at all?
No, he died of pneumonia.
Well, he did,
Yeah.
right.
Now, Terry Pratchett is an interesting example because, see, Terry Pratchett, I met him at a meeting in Zurich 3 years ago, again of this World Federation of Right to Die societies. By the way, you know, we've got these societies in the UK. There are about 70 Right to Die societies around the world in about, say, 50 different countries. And every 2 years we meet up. It's like a wonderful alumni association getting together. We compare notes. Anyway, Terry Pratchett was at this conference 3 years ago in Zurich, and he already had his, diagnosis of early dementia. He was an excellent campaigner for changing the law, and he financed mainly the Faulkner Commission, which was established about 3 or 4 years ago, which led to the draft Faulkner Bill in the House of Lords. And yet it's ironic that Terry Pratchett could never have been helped by that Faulkner Bill unless he became terminally ill. But he had an advanced decision, and in it, I'm told, he said that he did not want to be treated if he got something like pneumonia, and I'm told on good authority that that is what he died from.
Yes.
Sorry. You know, you were talking about the two old ladies with the deafness and blindness.
I'm sorry?
Can you hear me?
I don't know whether you have a noise over your mic. I have a noise over mine. Come up here and talk to us.
You know, you were talking about the two ladies with deafness and blindness.
Well, one was male and one was female, they were cousins.
Cousins,
Yes.
yeah. Did they have any other comorbidities that would sort of enhance the decisions to go?
Are you a medical student?
I'm a student nurse.
Okay. When you said comorbidities, I realised you had a medical background. To my knowledge, those are the only, I never met them, so I only go on what I've been told about them, but those were their two main problems. One deafness, one blindness. But in their 80s, you can imagine they had some other problems as well, but I'm not aware of them. The one thing that worries me, and again, I find it fascinating to get questions because other ideas come into my head. The one thing that worries me is that there will be a law change in this country because of the economic burden of older people. It never will be admitted that this is a reason to have a law on right to die. It would be, to me, it would be a wonderful side benefit. But you can imagine, say, in 10, 20, 30 years' time, politicians saying, well, if some people want to end their lives sooner than others because they've got certain medical conditions and they're mentally competent, why shouldn't they have the right to do so legally and properly with a doctor's help, rather than continuing to be receiving treatment under the NHS, which is becoming more and more of an economic problem. So you may well find that economic reasons will determine this. And the other, of course, the other main factor is, and you know, the reason why Lord Faulkner's bill was not voted down by a majority in the House of Lords last year was because the Supreme Court in the summer of last year, they had had appeals made to it by the widow of Tony Nicholson, because he had gone through the legal process, remember, and then been rejected, 2 years ago. But his widow kept on his appeal. There's also a man called Paul Lamb, who lives in Yorkshire, who is paralysed from the neck down from a car accident. And he also went to the Supreme Court last year on the basis that not being allowed to end his life because of his disability mean that there was an infringement of his European human right to choice. And the Supreme Court took the decision last summer to say that Parliament had to discuss this matter again. Otherwise, the courts will have to judge on each individual case. And that is why when Faulkner's bill came up for serious debate in the House of Lords last autumn, the opposition, which has still a majority, a slight majority in the House of Lords, knew they could not use the same tactics they'd used against Joel Joffre a few years beforehand and torpedoed it at the second reading. They said, all right, we will discuss Faulkner's bill, but they introduced over 100 amendments, knowing very well that time wouldn't allow for those amendments to be discussed before the end of the present Parliament. However, they had these debates. One I mentioned earlier led to this inclusion in a future draft bill in this country that there had to be someone from the family division of the High Court to question a person wishing to die, to make certain there's no outside pressure. They also had a serious discussion in the House of Lords about changing the name of Faulkner's bill from assisted dying to assisted suicide, and even some of the supporters of Faulkner said it's more correct to call it an assisted suicide bill. That amendment was not adopted. So that's why these discussions are important, because they provide a, shall we say, a better edition of what bill will come up. As I mentioned earlier, the present tactic of dignity in dying is to get a private member's bill soon into the new House of Commons. So it'd be fascinating to see what happens in our general election in a few weeks' time. Because in the present House of Commons, or rather the one that's just now been disbanded, there was a slight majority against changing the law. Although the majority of people will say, 75% plus, the law should be changed, there was an estimation that the majority of the retiring MPs would not have been in favour. So it'd be fascinating to see what happens in the new Parliament. And if we have a coalition government, and I even heard on the radio programme today that they're not thinking just about maybe two parties, maybe even a third party, and one party being mentioned is the DUP from Northern Ireland, which will be totally against changing the law, because they're totally against abortion, for example. The membership of the new House of Commons will be very crucial about whether a bill will be adopted or not. Now, among the existing parties in this country, the Green Party has official policy. The law should be changed. Excuse me. The Lib Dems have an official policy to also change the law, which they adopted 12 years ago. Some of you may remember Ludovic Kennedy, and he introduced a law, a motion in the Lib Dem conference way back then to say that the Lib Dems would support a change in the law. It's now been put onto the back burner because a survey of the members, the Lib Dem members in the House of Commons up until last week showed that it was about 50-50 whether the Lib Dem MPs would support a change in the law, although it's officially part of their party policy. So look carefully at who might be in the House of Commons, because if it's rather a conservative bunch of people, and again, the SNP, which might be a major factor, I think by and large is more bound by religious influences than the Labour Party in Scotland is, so therefore they might be also against changing the law. So don't be certain that there'll be a majority in the new House of Commons in changing the law. I often get asked, when do I think the law might be changed, even for the terminally ill in this country? And I've always said, in 5 years' time. But I said that 10 years ago.
Yes, gentleman recorded.
I thought your point about kind of economic priorities coming into this at some point in the future and determining whether we go with it or not, quite interesting, because although I'm totally in favour of what the Swiss are doing now, and I'd like to see the whole of Europe adopted, okay? If you look at what the opponents of euthanasia are saying, is the reason why Switzerland adopted that policy in the first place back in the 40s is because it came out of the eugenics movement of the 30s, which was very popular among certain reactionary political forces around the time that we all know were around in the 30s and 40s. And it was possible for those eugenicists to kind of work through the war because they weren't part of the war, and develop the whole idea to the point at which it became an acceptable practice. Now I don't accept this, but I've heard it put forward as, if you like, smearing the whole movement, and I think we should be capable of responding to it. Just like to know, have you heard that argument and have you got a response to it?
I have heard that before. I'm not sure it was that major an influence in Switzerland. back in the 40s. I go to Switzerland quite often. I like to just keep in touch of what they're doing there in this area. And I think the Swiss, a bit like the people in Oregon, they're fiercely independent people. And it's for that reason that I think more than anything else is why they've always supported the possibility of an assisted suicide in their country.
You mentioned earlier that you were in the past chair of the Voluntary Euthanasia Society, and they changed their name to, you mentioned change their name to Dignity-He, you mentioned they did since already in the document, which is nice and alliterative and catchy. Was there anything more to it than just being alliterative and catchy or popular?
That's a good question, Tony. Terminology, as I mentioned at the very start, is very important. Most of us shy away from the word suicide. You know, we regard it as an act of a sad person, perhaps. You know, someone who's depressed because they've lost a job or had a divorce or something. That's why, to me, it is vital to have the word rational suicide put in place. Likewise, the word euthanasia, again, has connotations of what the Nazis did in their country against, you know, the Jewish population and other people in their country. That gave it a bad name. That's why, again, it's vital to use the word voluntary euthanasia. Although nowadays you'll find in the Netherlands and in Belgium, they're quite relaxed about the word euthanasia. They don't even put the word voluntary in front, although it's by implication it's there because the doctors are involved in making certain that it is a voluntary request. But still, I think in the kind of Anglo-Saxon world, whether it's this country or in the States, we just haven't kind of liked those two words, euthanasia and suicide. So dignity in dying was, as I said, it was actually picking up the slogan that VES had, but that became, shall we say, a more sanitized word or title to use for the organization. But at the same time, I'm thinking about, now I'm going to do a bit of self-promotion. This book I'm going to give out, I got 20 copies here, is, I say, free of charge. But the book I edited, it came out about 6 weeks ago, which I edited with another doctor, Colin Brewer, which is a collection of 30 essays by various people, like Mary Warnock, Will Self, Chris Woodhead, Lord Avebury, people of that stature, talking about how they would like to die. The title of the book is I'll See Myself Out, Thank You, which has the acronym of ISMOTI. You can buy it on Amazon, £10.99. You can get it as an e-book. And in that book, Colin Brewer and I have written individual chapters. I've written about old age rational suicide. I've written about accompanying people to Switzerland. Colin is a psychiatrist who has done some of the mental competence evaluations in this country of people who have gone to Switzerland. People who either were in early stages of dementia, or some people who had a history of depression. That wasn't the reason they were going to Switzerland. They had a physical reason to die there, but they had had maybe a history of depression in the past, and the Swiss doctors required them to have a psychiatric evaluation here, and Colin has done that, and he writes up about these people, not by their full name, just by their first name, in a chapter in this book. But in that book, we have introduced the expression of MARS. Now, not the candy bar, but medically assisted rational suicide. And we have a whole chapter explaining why we think this might be a good term. We also, on the back cover of that book, quote Mary Warnock, who said, I dislike the expressions of well, like I said, I preferred the expressions of euthanasia and suicide to the expression of assisted dying. Let's call a spade a spade. So it's a book called I'll See Myself Out, Thank You. You can get it on Amazon.
Thank you very much, Michael. Anybody else? Final question?
Could I make one final quotation?
Yes?
I go back to my original introduction, talking about December the 10th, Human Rights Day, and saying that this is essentially, to me, a human rights issue. Now, this is a quotation from the European Court of Human Rights in April 2002. Concerned Diane Pretty. Do you remember Diane Pretty? Diane Pretty had motor neuron disease, and I was then chairman of VES, and we helped her go all the way to the European Court for her to then get a declaration from the court that it would be her right to die in this country. The court said no, it's up to the national parliaments to decide. But in their judgment, they wrote the following. This is a quotation. In an era of growing medical sophistication, combined with longer life expectancies, many people are concerned that they should not be forced to linger on in old age or in states of advanced physical or mental decrepitude which conflict with strongly held ideas of self and personal identity. There you have it all. People who should not be forced to linger on in old age or when they are mentally or physically decrepit, if those possibilities, those situations conflict with their strongly held ideas of personal and self-identity. It is a human rights issue, thank goodness.
Thank you very much, Michael. I'm sure we've heard a lot that will perhaps stimulate us to certain actions, like people do in my case, and will give us much food for thought in the future. Thank you for a very impressive evening, Michael. I think Dennis will correct me if I'm wrong, but next month we have a very different sort of subject, almost at the sort of opposite end of life, on the matter of censorship of students.